let's talk step 4, the intervention for each of these breaks. Now, the first break, number 1, is pressure for sex. And remember, this is what Kelly identified. She circled pressure for sex as her number 1 break. In order to treat this, sex needs to be entirely off the table and explicitly off the table. Because Kelly and James might look at you and say, well, yeah, we've been avoiding sex. It has been off the table. But the problem is it hasn't explicitly been off the table. So there's always been the is he initiating? Is he not? Is she open? Is she not? There's still been a lot of that pressure around their sexual relationship. So you need to help them make it explicitly off the table. They need to agree, no sex. This is only a Band-Aid. This is not forever. This is an initial treatment intervention to take the pressure off of sex. Again, this is not forever. If this was forever, the couple would say to you wait, I'm sorry, we're going to you to have better sexual desire and you're telling us to take sex off the table? No, this is just a temporary Band-Aid to remove pressure so then you can start working on other things in the treatment plan. Now, one big obstacle for this is that, like I mentioned before, James might be pretty confused and say, you're supposed to be helping us have more sex, and now you're telling us not to have sex. And so this is where you can say something to James, is what you're currently doing working for you? And more than likely, he's going to say, no, it's not. And so that might give them enough buy-in to say, then let's try something new. This is only temporary. Let's try something new in the sexual dynamic. We need to hit that reset button. So this no sex agreement really sets the stage for the next interventions. And the next interventions, you're going to be addressing the second thing that hits the brake pedal and the third thing that hits the brake pedal, which we'll get to in a moment. Now, another important piece is, now that sex has been taken off the table, is James has really identified that sex is the primary way that he connects. And so if they're going to agree to officially take sex off the table, that's going to feel like a huge loss to him. I know, even though they haven't been having sex, they've been in that avoidant dynamic. Now it's not even a possibility. So that can feel like a huge blow to James. How do I feel connected to my partner? So I would assign the couples an exercise to really get creative in the ways that they connect. So you can ask them to make a list of kind of 10 different non-sexual ways to connect and to begin to implement these things. Matt Gottman just came out with a great book called The Love Prescription, which is a 7-week guide to connect. So all of these are good options just to help the couple find other ways to connect, and especially for James not to be so reliant on sex having to be how to connect. Research really shows that it is the small connections that often bring couples together. It's not the big things. It's not okay, that means every month we need to have a big vacation. It's the small things that bring couples together. That Gottman book, The Love Prescription, will help them with these small things. But other things you can describe, which you can actually read in that book, are things like the 6-second kiss. 6-second kiss. Imagine every day when your partner leaves, you two just kiss for 6 seconds. 1,000, 2, 1,000, 3, 1,000. This is not a big old makeout session, but it's just a 6-second kiss to really pause and be present with each other. That brings connection. Stress-reducing conversations. These are conversations that are no more than 10, 15 minutes long, where each partner just gets to vent a little bit and the other partner is empathic and doesn't problem solve and doesn't give advice, but just listens and gives empathy. All of these are tiny things that don't take up a lot of time that really help bring connection. Now, another piece for James is if sex is off the table, then he really needs to learn another way to address his sexual desires and sexual wants. So this is where a discussion of what does the couple think about self-stimulation? Another term for that is masturbation, but I like to use the word self-stimulation because it has a lot less kind of emotional and negative baggage to it. So I'll ask the couple, how do you both feel about self-stimulation in your relationship? Kelly and James says they're fine with that. And so having a discussion with James that for his sexual wants and desires, he really needs to be focusing on self-stimulation to get those met, now that the couple has agreed that sex is totally off the table.